say a regular scan using glucose, I think that may be a referral to FDG PET scan. And that's a form of sugar and is useful for ordinary cancers. And the reason being that the cancer cells are multiplying. That's what cancer is, multiplication of a particular type of cell at a high rate, uncontrolled. And these growing cells need energy to do their multiplication. And so they use sugar as a source of that energy. Therefore, the sugar attached to the radioisotope that's used on the scan, that's so-called PET scan, concentrates in the tumor and therefore carries along with it the radioisotope, which shows up when they take pictures with a so-called isotope imaging camera. But carcinoids are very slow growing and don't usually take up that much. So then they take up some, but they're not as good as in being imaged by that technique. Now, the Octreo scan, which is a scan that uses octreotide, a synthetic form of somatostatin, a hormone that is important in carcinoid disease. That scan was the standard used most of the time in the past, but now we've switched over to gallium-68, an isotope scan of a type that's even more sensitive for these tumors than the Octreo scan. And that's one of the better ways of diagnosing the location, the presence, and how much tumor is there. However, it's not infallible since there are a few other conditions that will light up on a gallium scan, such, for example, as sarcoid, recent scarring. That's why we don't do it immediately after an operation, and a few other types of infections that can light up and give a false positive. So it's not really false, it's a true positive, but it doesn't indicate carcinoid. We also have ways of diagnosing, or at least aiding in the diagnosis, to use substances that are elaborated by the carcinoid tumors, such as chromogranin and pancreastatin, substance P, neuron-specific enolase, which is seen in the tumor and the biopsy of the tumor, and a few other substances, so that though the primary way of diagnosing is biopsy, it may be just a needle biopsy, but these are confirmatory techniques. Well, yes, you can remove the primary, but have the hormonal products responsible for the carcinoid syndrome being produced by metastases.
Mm.
So even though the primary tumor is removed, there's still tumor present in the body, and if it's active enough or functional enough, making enough of these hormones to provoke the symptoms, then you can have the syndrome. It's been known to happen very rarely, but it can happen. It's so rare that most of the time when it does, it's written up in the medical journals. the commonest metastases of carcinoid? Well, it depends, of course, on where it originates, but assuming that we're talking about one of the more frequent types, namely origin in the small intestine,
Right.
it first spreads to the wall of the intestine, then it spreads to the lymph nodes adjacent to the intestine, and then to the lymph nodes a little bit more distant in the mesentery and within the abdominal cavity.
Mm.
And after that, the usual spread is to the liver or the peritoneum. It also depends to a slight degree upon the location of the carcinoid, since the majority of carcinoids are in the gastroenteropancreatic system, and particularly the lung and the small intestine. In general, the consensus of opinion by experts is that testing should be done in follow-up for about 10 years. Some people think that it depends upon the aggressiveness of the original tumor, and would do follow-up even longer, but 10 years is the general suggestion. Even though carcinoid is provoked by adrenaline, epinephrine, and these lung inhalers have some actions similar, nonetheless, they are used with good effectiveness in carcinoid. And this is a form of treatment in which a radioisotope, nowadays it's lutetium, known as Lutathera, is attached to a derivative of somatostatin. And this drug is attracted to the receptors in the tumor. About 80% of carcinoids in the small bowel have those receptors. So it's delivering a form of internal radiation treatment that's highly effective in killing off the tumor.